Medical gaslighting. What does that term really mean?
I remember when I was telling some colleagues, like, hey, I'm writing this paper on medical gaslighting. I could see the tension we're writing about what? Ugh. You know, when you have somebody who's essentially manipulating or making somebody question their lived reality, they're throwing them off their equilibrium. Appointments are incredibly short and the provider is just going insanely fast because they have 20 some odd people, they get 15 minutes per person and they're just trying to get to the point.
Are there certain patients who are more likely to be dismissed?
So I go into the emergency room by myself and I say, I'm in extreme pain. And I say, hey, just so you know, if you're going to order a pain med, I've had all these surgeries, I need Dilaudid. Of course, then I get accused of drug seeking. Let's just say that provider thinks like, okay, they are exaggerating, getting curious and saying, okay, why might they be? Oftentimes patients might, because that's the only way they've ever been believed before. Especially that drug seeking label can be terrifying for patients and can often prevent folks from trying to get the help that they need. Especially with women talking about endometriosis, that'll come through my office fairly often. And yeah, I was in this much pain and this, and I was told like, oh, it's probably just period. It's just a regular period. It's fine. And it's just, oh my gosh, no.
Especially, I think if you don't have a diagnosis, you don't have a name to the disease, would that create more confusion?
Again, we're asking providers to do intense work in short slots. Leadership, please give these folks a break.
Yeah. Is there harm in over-validating symptoms? What do you think?
I am not omnipotent, nor am I perfect. Where one of the best things I ever learned was how to say, I don't know.
Yeah.
And you can say that in a way that doesn't mean like, well, I don't know. Good luck with that.
Yeah.
You say, I don't know, but I want to work together to figure this out. It's the difference between I walk up to your car and I key it, or I happen to just walk past your car with my keys in my pocket and I scratched it. I would say, build that trust, build that confidence and that warmth. Once you have that rapport, things tend to just go so much more smoothly.
Don't be fooled by me. Don't be fooled by the face I wear, for I wear a mask, 1,000 masks. Masks that I'm afraid to take off.